Mr. Chairman, thank you very much. Mr. Secretary and your colleagues, thank you for being here. I have 3 or 4 questions I'd like to raise about specific programs, particularly of interest to me as a senator from Kansas. The first one is a program, a law that was passed in 2010. I was in the House of Representatives then, chaired the Healthcare Subcommittee on Veterans, and we were successful in passing a bill called Access Receive Closer to Home, ARCH. And the crux of that effort was to recognize, particularly a state like ours, like mine, that VA hospitals are a long way from many veterans. We initially addressed that with outpatient clinics, and that provided routine services closer to home, but still miles, hours away for many of veterans in our state. And so my effort was to, with the support of many of my colleagues, including the Senator from Arkansas, we were successful in passing legislation that would require the VA to provide services in a sense, hometowns where the veteran chose to have those services provided if they lived more than a certain number of miles away from the CBOC or the VA hospital. That was narrowed down before the bill was passed. It became a pilot program. That pilot program has been in place now for 3 years. Reports, I assume, are either on your desk or soon to be on your desk, and my initial question is, do you have thoughts about this program's success and what the department's plan is for its continuance?
The report hasn't yet arrived, so I await that. I think we learned a lot from Project Arch, and we have, in the meantime, put in place some other initiatives that are VA programs that address some of those lessons that we got out of Arch. I don't know what the next step is going to be with Arch, but let me call on Dr. Petzel to talk about some of the things that we've implemented, not the least of which is telehealth, to help try to bridge even those remote and rural areas where veterans have no access to health. Right?
Senator Moran, thank you. The pilot was done in 5 different networks, and as you know, Kansas was one of the, Pratt County was actually the place where we did that. Various things were done in a couple of instances. Primary care was provided, but in the bulk of places it was a specialty care kind of phenomena where if the veteran needed and wanted specialty care in the community, we were able to provide that. We've made progress in other areas since then, as the Secretary alluded to. With telehealth, telehome health, we're in a much better position now to provide specialty care in remote areas than we might have been 3 or 4 years ago. In addition to that, in anticipation of the pilot for Arch ending, we've developed a new program nationwide called PC3, which is a program by which we have developed networks around the country to provide specialty care on referral. In other words, a referral network where if somebody lives in a remote area and a decision is made they need to have specialty care and it's inconvenient, not appropriate for them to travel, we can go to that contract provider under the PC3 contract and provide that care in the community. The program started in January when the first network was set up. It's now fully operational around the country, and the business is booming, so to speak. We're seeing the contract and the network being used all over the country. In addition to that, we do have the capacity, and we always have had, to provide for fee-basis care in the community, and have used that extensively, particularly in places like Kansas, again, where it's just not appropriate for someone to travel 200 miles to Topeka or to Wichita or into Kansas City.
I appreciate that answer. We want to continue to work with the VA to expand this program. Pratt County is one of, it's important that we test this, I suppose, in a small county, although when the legislation passed, I expected it to be tested VISN-wide, and the VA narrowed it to a county, which is a significant difference in the outcome. First of all, I would ask Secretary Shinseki if he would give us an idea of when he is going to receive the report and when we can, about Arch, and when we then could see the results. The answer to when we could receive a report.
It's coming to me from Dr. Petzel. I just asked him that question, Senator, and he said shortly.
Very
So I assume I'll have it before the sun sets today.
All right.
Oh. Thank